If you have ever been on Suboxone or loved someone who is, there is a good chance someone has said this to you. You're just replacing one addiction for another. I hear this almost every day in my clinic, from patients who are starting to doubt their own treatment, from family members who think they are helping, and sometimes from people in recovery communities who genuinely believe it. It sounds logical, it feels like a reasonable concern, and it is one of the most harmful myths in addiction medicine. Today, we are going to break down exactly why it is wrong, what addiction actually is, and why this misconception costs lives. Hi, I'm Dr. Jonathan Shirman, a board-certified addiction medicine physician. Welcome back to the channel. This is where I break down everything about addiction treatment, recovery, and the things most doctors never get the chance to explain. Before I get into this, if you haven't seen my last video, where I break down everything you need to know before starting Suboxone, how it works, what to expect, and why timing matters, I would start there first. I will link it at the end of this video. So let's get into it. What is addiction? To answer this question properly, we have to start with a definition, because the word addiction gets used constantly and almost never correctly. Addiction is a compulsive use of substances despite negative consequences. It is characterized by a loss of control. The substance is running your decisions, your relationships, your job, your health, your safety. None of it overrides your pull to the drug. That is addiction. Dependence is something completely different. Dependence means your body has adapted to a substance and will go through withdrawal if you stop it suddenly. That is a physiological process. It happens with blood pressure medications, it happens with antidepressants, it can happen with steroids. We do not call any of those addictions. Dependence simply means your body has adapted to a medication. Addiction is about behavior and loss of control. These two things, addiction and dependence, they're not the same. They're not even close to the same. And confusing them is the root of almost every harmful thing said to people on Suboxone. So when someone says Suboxone is just replacing one addiction with another, what are they actually saying? They are saying that your body is dependent on Suboxone, the way it was dependent on opioids. The situation is equivalent, that you have not actually gotten better, that you are still an addict, just a different kind. This is wrong for several reasons. First, Suboxone does not produce the same effects as opioids. There is no euphoria, there is no high. There is no compulsive drug-seeking behavior. The brain is not being flooded with dopamine, it's being stabilized. Second, the person on Suboxone is functioning. They are going to work, they are present for their family, they are making decisions, they are living their life. The addiction was running their life, the medication is not. Third, we do not apply this logic to any other medication for any other disease. A person with high blood pressure who takes medication every day is not called an addict. A person with diabetes who needs insulin to function is not told that they are just replacing one dependency for another. We call those people managed, and we call that treatment working. The double standard applied to addiction medicine is not based in science. It is based in stigma. But the real reason that this myth matters is not that it is just incorrect. It is that believing it leads people to make decisions that can put their lives at risk. I want to be direct about this because I see the consequences of this in my practice. I have had patients who were doing well on medication come back months later after stopping it because someone told them they weren't really in recovery. When people hear this from someone they love or someone they trust, they often stop their medication. They stop it because they want to prove they really are in recovery. They want to show they can do it without a crutch, and they want to feel like they are truly sober. And then they relapse. And right now, a relapse after a period of abstinence is one of the most dangerous moments in opioid use disorder because tolerance has dropped and fentanyl is everywhere. And the dose that was manageable before is now potentially fatal. People die because of this myth. This is not an exaggeration. This is what the data shows and what I see clinically. If someone in your life is on Suboxone and someone tells them that they are really not in recovery, that is not tough love. That's just dangerous misinformation. I want to offer a different way about thinking about recovery because I think the way most people define it is setting up people to fail. Recovery is not the absence of medication. Recovery is the presence of a life worth living. It is waking up and being present for your kids. It is going to work and being reliable. It is having relationships not defined by chaos. It is making decisions that align with who you want to be. Suboxone, when it is working, makes all of that possible. For some people, it is just a bridge. They use it for a period of time, stabilize, do the underlying work, and eventually taper off with their doctor's guidance. And for other people, it is long-term treatment. The same way blood pressure medication is long-term treatment. Both of those outcomes are still recovery. The goal is not a pill count. The goal is life. I want to acknowledge something because I think it is important. There are people in recovery who did it without medication, who believe deeply that abstinence is the only real path. And I respect that. That path works for some people, and the commitment it takes is real. But what the data shows consistently is that medication-assisted treatment reduces overdose deaths, reduces relapse rates, and improves long-term recovery outcomes compared to abstinence-only approaches for opioid use disorder specifically. Both paths deserve respect, but only one of them should be telling people to stop their medication. If you're on Suboxone and someone has made you feel like you're really not in recovery, I'd like you to hear this directly. You are in treatment for a serious medical condition. You are doing what your doctor recommended. You are showing up for your life in a way that addiction made impossible. That is true recovery. The stigma around medication-assisted treatment is a barrier to care. It keeps people from starting treatment. It pulls people off treatment that is working, and it can cost lives. You do not have to justify your treatment to anyone. The next time someone says this to you or someone you love, you now understand the science behind why that statement is so wrong. Next week, we're going to talk about fentanyl specifically and how it has changed everything about starting Suboxone. It is one of the most important things anyone in treatment right now needs to understand, and almost nobody is explaining it clearly. If you found this helpful, make sure you subscribe so you don't miss a new video every week. And if you have a family member or someone you love who is navigating addiction treatment and you are not sure how to support them, I put together a free guide called The Family Guide to Addiction Treatment. It covers what to say, what not to say, and how to actually help. The link is in the description below. I'm Dr. Jonathan Shirman, and I'll see you in the next one.